Hello, learners. Welcome to Lecture 30, the concluding lecture of Module number 4. Today, we will explore how media and communication strategies can be harnessed to promote awareness about reproductive and child health. While we have examined culture, gender, and legal aspects in earlier lectures, the effectiveness of interventions depends ultimately on how this information is communicated. Media, in its many forms, shapes public understanding, influences behavior, and drives social change. In this lecture, we will analyze the role of traditional and digital media, interpersonal communication, campaigns, and emerging strategies in creating awareness and transforming attitudes towards RCH. Communication is one of the most important tools in public health. It is not just about transmitting information or about shaping knowledge, attitudes, and behaviors. In reproductive and child health, where stigma, myths, and cultural barriers often exist, effective communication is essential. Media campaigns, interpersonal counseling, and digital strategies can bridge gaps between services and communities. Without strong communication, even the best health programs fail to achieve their intended outcomes. Communication is vital in RCH because it empowers people with knowledge and confidence to make informed decisions. Myths around contraception, pregnancy, or immunization often prevent service uptake. Effective communication counters these misconceptions and accurate, relatable information is given to the community. Furthermore, communication strategies encourage utilization of services such as antenatal care, intranatal care, or postnatal care by reducing fear and anxiety and building trust in the community. Thus, communication acts both as an enabler and a bridge in the pathway to better health. Communication strategies like RCH take multiple forms. Interpersonal communication, such as between health workers and families, is highly effective in personalized counseling. Good communication through community meetings or workshops creates peer support and collective discussion. Mass communication using print, radio, television, and digital media reaches wider audiences with consistent messages. Each type has unique strengths, and effective programs often combine them for maximum impact. Mass media is a powerful vehicle for promoting reproductive and child health. Its wide reach allows messages to penetrate even remote communities. Media does not just inform but also shapes social norms, influencing what people view as acceptable or desirable behaviors. For example, campaigns promoting institutional deliveries have shifted community attitudes in many areas. Media also influences policymakers by bringing issues to public attention, creating pressure for reforms and resource allocation. Print media remains a very important tool in RCH communication, especially in rural and low resource settings. Posters, pamphlets, and leaflets displayed in clinics, schools, and public spaces provide visual reinforcement of messages. Newspapers allow dissemination in local languages, reaching literate populations. Even in areas with limited digital access, print materials ensures communities receive reliable information. Designing them with cultural sensitivity and visual clarity enhances their effectiveness. Radio is an accessible and affordable medium with significant reach in rural areas. Community radio stations, in particular, provide locally relevant information in familiar languages and dialects. Interactive programs such as call in shows or health quizzes encourage participation and allow communities to seek clarifications. Radio has proven effective in campaigns for immunization, maternal health, and family planning, making it a critical tool in promoting RCH awareness where television and internet are less available. Television offers a unique advantage by combining visual and auditory appeal. Health messages embedded in entertainment formats such as dramas, serials, or advertisements reach wide audiences while maintaining engagement. Entertainment education strategies have successfully addressed issues like HIV prevention, family planning programs, and maternal health. By showing relatable characters and narratives, television can shift norms, promote empathy, and encourage viewers to adopt healthier behaviors. Digital and social media platforms have revolutionized health communication. Mobile phones, messaging apps, and social platforms like WhatsApp, Facebook, and Instagram, which enable rapid, low cost dissemination of information. They are particularly effective for engaging young people who are often neglected in our traditional campaigns. Social media allows interactivity. Users can ask questions, share content, and build on online communication around health topics. With careful management, digital campaigns can achieve wide reach and sustained engagement. Interpersonal communication is the backbone of reproductive and child health programs. Health workers, such as ASHAs, accredited social health activists, and ANMs, our auxiliary nurse midwives, engage directly with families to counsel them on issues like contraception, antenatal care, or breastfeeding. This personalized interaction builds trust and confidentiality, which is critical for sensitive topics like family planning or human immunodeficiency virus HIV. Interpersonal communication allows messages to be tailored to individual needs and cultural contexts, making it one of the most effective communication strategies. To strengthen this, providers use active listening, open ended questions, and the teach back method to confirm understanding and correct myths. Couple and family sessions, engaging husbands and mother in laws, support shared decision making and reduce covert discontinuation of contraception. Confidential spaces, consent protocols, and adolescent friendly hours protect privacy of young clients and survivors of gender based violence. Simple job aids and digital tools helps ANMs and ASHAs match clients to the right method and manage side effects. Follow up via home visits, phone calls, or short message service reminders sustains continuity of postpartum contraception or iron folic acid adherence and immunization. Documentation on mother and child protection card and reproductive and child health portal enables tracking and timely referral of high risk cases. Supervisors use brief interpersonal communication quality checklists and client experience feedback to coach workers, continually improving respectful, culturally sensitive counseling. Community health workers play a vital role in communication for reproductive and child health. As trusted members of community, they can overcome skepticism and cultural resistance. Their close contact allows them to identify barriers, address myths, and provide practical solutions, acting as bridges between the health system and the families. They facilitate referrals, and encourage utilization of services. Their consistent presence makes them catalysts for sustained behavior change in reproductive and child health. They translate clinical advice into locally understandable language and messages through home visits, courtyard meetings, and women's groups using different methods such as stories, flipbooks, and the teach back method to confirm understanding. Ashas and ANMs map influencers, which influencers like husbands, mother in laws, religious leaders, and run couple or family sessions to support shared decisions on contraception, antenatal care, and newborn care. By maintaining due lists and mother and child protection cards, they track defaulters for immunization, iron folic acid, and postpartum contraception, and trigger early referrals via ambulances. For adolescents, they ensure privacy, consent, and adolescent friendly hours, linking youth to adolescent friendly health clinics under Rashtriya Kishore Swasthya Karyakram. They use simple screening and problem solving so households can act immediately. WhatsApp reminders, SMS reminders, and community scorecards keep follow up continuous and transparent. Regular feedback to village health, sanitation, and nutrition committees turns community insights into service improvements, reinforcing trust and uptake. Group communication through community meetings provides forums for discussion and learning. Women's groups, youth clubs, or village health days create opportunities for peer support and collective decision making. These settings encourage sharing of experiences, allowing individuals to learn from one another. Community dialogues also generate collective commitment, which can be more influential than individual persuasion. By fostering community ownership, group communication strengthens the impact of health programs. One very important strategy is behavior change communication that uses targeted messages to influence specific health behaviors. Unlike journal awareness programs, focuses on motivating individuals to opt for change and sustain that change. It often combines interpersonal communication, community activities, and mass media to reinforce consistent messages. For example, BCC has been used to increase contraceptive use by addressing fears, providing information, and creating positive role models. Its strength lies in integrating multiple approaches for long time impact. Effective behavior change communication begins with audience segmentation and formative research to map barriers and facilitators, that is, knowledge, norms, and access. Then designs messages using behavior theories such as COMB and the theory of planned behavior. Materials are pre-tested for clarity and cultural fit and delivered through mutually reinforcing channels like home visits, women's groups, school sessions, radio, WhatsApps, and clinic cues to action. Gender transformative framing engages men and mother in laws, tackles power dynamics and stigma, and protects privacy for adolescents. M Health nudges sustained behaviors like iron folic acid adherence, immunization visits, and postpartum contraception. Community role models and testimonial stories build social proof while small commitments convert intention into action. Monitoring goes beyond reach. Track intermediate outcomes, behavior change, and equity across caste, tribe, or rural urban strata. Above all, BCC must be right based and non coercive, informing choice, ensuring consent, and aligning with quality services so new behaviors are feasible, safe, and long lasting. Advocacy campaigns are critical for influencing decision makers and mobilizing resources. By preserving evidence, showcasing success stories, and leveraging media coverage, advocates can push for policy reforms or increase funding for RCH. Campaigns may target government leaders, local authorities, or donors. Media plays a central role in advocacy by amplifying voices, creating urgency, and shaping public opinion. Advocacy ensures that RCH remains a priority on policy agenda. Entertainment education is an innovative approach where health messages are woven into popular formats like television dramas, radio shows, or songs. These strategies are particularly effective with young audiences who might resist didactic messaging. By showing relatable characters practicing healthy behaviors, entertainment education normalizes change and creates emotional resonance. Examples include soap operas that address family planning or music videos promoting HIV prevention. These approaches combine education and enjoyment, enhancing impact. Branding is often overlooked in health communication but is very essential for consistency and recall. Campaigns like Pulse Polio or Janani Suraksha Yojana succeeded partly due to strong, recognizable branding that built trust and familiarity. Consistent logos, slogans, and visuals reinforce messages and makes the campaign memorable. Branding transforms abstract health messages into tangible, relatable initiatives that communities recognize and trust. Myths and misconceptions are major barriers to RCH. Communication strategies must directly address these through trusted voices like health workers, community leaders, or celebrities. Correcting misinformation requires clarity, cultural sensitivity, and persistence. Repeated reinforcement across multiple media ensures that accurate information reaches different audiences. Tackling myths is not just about facts but about trust, which must be earned through consistent and credible messaging. Influencers and celebrities bring visibility and credibility to health campaigns. Their endorsements create aspirational appeal, motivating people to adopt healthy behaviors. For example, celebrity involvement in polio and HIV campaigns in India contributed to mass awareness. While celebrities attract attention, their messages must be carefully aligned with program goals to ensure accuracy and avoid sensationalism. Used wisely, influencers can amplify health messages and reach diverse audiences. Traditional media, such as folk theatre, songs, puppetry, and storytelling, have long been used to communicate health messages in culturally resonant ways. These forms are accessible, entertaining, and familiar, making them powerful tools in rural and semi urban settings. When combined with modern media, traditional communication reinforces messages with local relevance. Integrating tradition and modernity ensures that campaigns resonate with communities while reaching broad audiences. Information and communication technology is transforming RCH communication. SMS reminders help pregnant women attend antenatal checkups and immunizations. Mobile apps provide information on family planning and reproductive health services. Telemedicine extends care to remote areas, supported by digital communication. These mHealth tools are scalable, cost effective, and highly impactful, bridging gaps between communities and health systems. Crisis communication is crucial in times of emergencies, such as epidemics or maternal health crises. During such times, clear, timely, and transparent communication builds trust and prevents panic. It also prevents misinformation. Clear, timely, and transparent communication builds trust. Effective crisis communication ensures that pregnant women, children, and families receive accurate guidance and services even in uncertain situations. Trust is the foundation of successful crisis management in reproductive health. Gender sensitivity must guide all RCH communications. Messages should be inclusive of both men and women, avoiding stereotypes that place responsibility solely on women. Campaigns should promote equality, depicting shared decision making and supportive partnerships. Gender sensitive communication empowers women while engaging men constructively. It ensures that health promotion does not reinforce inequality but actively challenges it and moves towards equity. Adolescence requires tailored communication strategies. Messages must be age appropriate, addressing curiosity and concerns without judgment. Using youth friendly platforms such as social media or school based activity ensures relevance. Communication must also challenge stigma around adolescent sexuality, creating safe spaces for learning and dialogue. Adolescent friendly communication empowers young people to make informed decisions, shaping healthier futures. Monitoring is essential to assess the effectiveness of communication strategies. Pre and post campaign surveys can measure changes in knowledge, attitude, and practices. Behavioral outcomes such as increased contraceptive use or antenatal visits indicate real world impact. Feedback loops allows programs to adapt and improve. Monitoring ensures accountability and helps allocate resources effectively for maximum impact. Ethical considerations are central to health communication. Messages must be accurate, honest, and respectful of people's dignity. Fear based tactics may achieve short term results but often backfire, creating mistrust or stigma. Communication should empower rather than frighten, providing people with knowledge and confidence to act. Ethical communication builds credibility and sustains trust, which are vital for long term impact. RCH communication faces multiple challenges. Low literacy limits access to print or digital information. The digital divide creates inequities, where rural or poor communities may be left out of online campaigns. Cultural resistance to sensitive topics like contraception or sexuality creates barriers to acceptance. Additionally, in today's information rich world, communities may face overload or confusion, making it difficult to distinguish between the good and the bad information or the accurate information. Overcoming these challenges requires innovative, context specific approaches. Effective communication requires partnerships. Governments and health systems provide authority and resources. NGOs and community organizations ensure grassroots relevance and reach. Media and private sector partners contribute expertise, platforms, and innovation. Collaborative efforts multiply impact, ensuring messages are consistent, wide reaching, and credible. Partnerships are essential for sustaining communication efforts and integrating them into broader health programs. The future of RCH communication lies in innovation. artificial intelligence and chatbots can provide personalized health information at scale. Data analytics show targeted messages based on community needs are very successful. At the same time, integrating cultural and digital strategies ensure that traditional beliefs are respected while embracing modern platforms. Future communication must be adaptive, evidence based, and inclusive, harnessing technology without losing cultural relevance. To summarize, communication is not an add on but a central component of reproductive and child health programs. Media and communication strategies shape knowledge, challenge norms, and influence behaviors. Multi channel approaches that combine interpersonal group and mass media communication are most effective. Campaigns must be ethical, inclusive, and culturally sensitive to succeed. Ultimately, communication is both the message and the method for achieving healthier families and communities. In conclusion, media and communication strategies are powerful catalysts for promoting reproductive and child health. They transform knowledge into action, myths into understanding, and stigma into acceptance. By harnessing the full spectrum of communication tools, traditional, modern, and digital, we can empower communities, foster equality, and improve health outcomes. As future professionals and advocates, your role is to design, implement, and evaluate communication strategies that inspire positive change and uphold the vision of health for all. This is all for today, and this is all in Module 4. In the next lecture, that is lecture 31, we start our Module 5, which is about child health development and welfare. And the lecture 31 will be about child growth and developmental milestones. Thank you.